4 indications for Botox in neuroophthalmology. So indication number 1, eyelid and facial spasms. Some people have spasms of their eyelids where they're blinking excessively and their eyelids actually close. It's called Blepharospasm, or maybe half of their face is in spasm, called hemifacial spasm. Botox works great for that. Indication number 2, when it's not full face spasms or bilateral spasms, sometimes people have like a little twitch in their eyelid. I'm sure you've had it. I've definitely had it. It's called eyelid myokymia. Usually it's associated with lack of sleep, stress, too much caffeine, but when it doesn't go away after a couple of weeks or even after a couple of months, Botox is an amazing solution. Number 3, tearing, excessive tearing caused by crocodile tears. Usually when people have a facial palsy, like a Bell's palsy, sometimes the nerve regenerates, goes to the lacrimal gland, causes excessive tearing, especially when chewing. Botox works great up here into the lacrimal gland. It can take care of it. And number 4, tooth clenching, particularly at night, can lead to headaches. So sometimes to prevent that clenching, Botox can be injected into the jaw muscle, the masseter over here, to relax that muscle. So if you've had any of these issues, eyelid spasms, eyelid twitching, excessive tearing when chewing, or jaw pain and headaches, then maybe consider some Botox. It's not just for cosmetics.